Hello, everyone, and welcome. You're watching Eagle News America. I'm Anna Clee, coming to you from Las Vegas, Nevada. It is Sunday, April 25, 2021. Tonight, we have updates from several of our correspondents across North America. In Honolulu, Hawaii, Bureau Chief Alfred Asenas reports about U.S. senators showing solidarity after passing the COVID-19 Hate Crimes Act. In Edmonton, Bureau Chief Thomas Likeness In Las Vegas, Ruth Adornicio shares with us updates on Southern Nevada's COVID-19 status. In Washington, D.C., Eliza Gonzalez-Manglikmot.
Ahead of May 1 Day of Action, D.C. opens walk-up vaccination sites for residents 65 and above. Plus, Philippine Embassy reminds dual citizens of required entry documents.
In Swarthmore, Bureau Chief Myla Simbulan.
Coordinated efforts between state, local officials, and community leaders to reduce gun violence in Philadelphia and across the Commonwealth.
In Seattle, Bureau Chief Frendel Fejeran tells us about how getting vaccinated is a source of comfort in this time of uncertainty. For EBC Sports, Tandy Somagi in New York.
The Knicks extend their winning streak to 9 games.
Michael Hudson in Seattle, Washington reports about the NBA community responding to the conviction of ex-police Derek Chauvin. In Denton, Eagle News correspondent Anita Manawas takes us to a place that grows chairs. Yes, you heard it right, chairs. Watch out for that. Plus, tonight's roundtable is still about chairs. We will share stories about this favorite piece of furniture. Our coverage begins now. Here's today's COVID-19 numbers. According to the Coronavirus Resource Center of Johns Hopkins University in Medicine, as of 6 p.m. Eastern Time Sunday, April 25, 2021, the number of cases of COVID-19 reported worldwide is now more than 146,726,000. Top 3 on the list of countries with recorded cases: U.S. more than 32 million, followed by India more than 16.9 million, and Brazil more than 14.3 million. This virus has now already claimed more than 3,103,000 lives worldwide. Top 3 countries with the most number of COVID-19 related deaths are U.S. more than 572,000, Brazil more than 389,000, and Mexico more than 214,000. In New Delhi, coronavirus patients struggle to find beds, oxygen, and vital medical supplies as India's capital extends its lockdown, while the country's COVID-19 crisis grows with infections and deaths hitting record highs. Family and friends of COVID patients are in despair as people there get infected and die at an alarming rate. A warning to our viewers, the following clips contain graphic content.
और 3 दिन से लगातार ट्राई किया, कभी इस अस्पताल कभी उस अस्पताल, इतना बुरा हाल कभी नहीं देखा था मैंने। मैं क्या करूं, मुझे समझ में कोई रास्ता नहीं सूझ रहा, मैं क्या करूं सुबह से ना कुछ खाया ना पिया, सिर्फ अस्पतालों के धक्के खा रहा हूं।
उधर गाजियाबाद के साइड में सारे हॉस्पिटल में गया, किसी ने भर्ती नहीं, सब लोगों ने कहा ऑक्सीजन खत्म हो गया। फिर यहाँ पर जो राजीव गांधी में आया, वहाँ पर गेट पर से ही भगा दिया, कहीं नहीं देंगे। यहाँ पर आया तो यहाँ पर केवल कोरोना टेस्ट हुआ था, उसके बाद जो है दवा तक भी नहीं लिखा। उन्हें कई कितनी बार बोला कि दवा वहाँ से यहाँ, यहाँ से वहाँ, कम से कम 2 घंटे तक घुमा था।
अच्छा मैम अभी अंदर ही थे हम, अंदर पता बाबा के पास 3 डेड बॉडी रखी थी आसपास ही। बाबा इतने ज़्यादा पैनिक हो रहे, बाबा कह रहे मैं नहीं बचूंगा, बाहर लेके आए तब थोड़ी समझ में।
Colombia soldiers patrol the streets of La Sierra neighborhood in Medellin to impose a night curfew in the Colombian city. Colombia is suffering from a resurgence of the virus that has increased the occupancy of intensive care units to 80%, with the health system coming under increasing strain. Army Major Douglas Arena says their presence aims to reach out to people not following the safety protocols.
Vamos a estar en los barrios haciendo un control de alguna manera pedagógico frente a la población civil, recordándoles en estos momentos la situación del COVID, no solo a nivel nacional, sino a nivel mundial en este tercer pico. La idea es interactuar con estas personas que están de alguna manera incumpliendo este decreto, hacerle...
Meanwhile, in Uruguay, people between 18 and 70 received the Sinovac vaccine against COVID-19 at a drive-through center at the country's Carrasco International Airport. Intensive care workers in Uruguay are at their wits' end. While they work day and night to save the lives of coronavirus patients, the population at large, they say, seems unperturbed by the mounting health crisis. Tiny Uruguay, with its population of 3.5 million, has gone from a shining example of COVID-19 control to a nation in a pandemic crisis. Figures show a 2-week infection rate of 1,331 per 100,000 inhabitants, by far the highest in the world. In absolute numbers, the country wedged between Brazil and Argentina is registering about 3,000 new cases per day and almost 60 daily deaths. With 2,022 in total, Uruguay has had fewer deaths as a percentage of its population than most Latin American countries and many in Europe. But in the last 2 weeks, it had the region's highest death rate. The country has never had a lockdown, and restaurants and bars remain open. A major contributor to Uruguay's fast-spreading outbreak has been its proximity to hard-hit Brazil and its more contagious P1 virus variant, which has spread across the border. The government has steadfastly rejected calls for a national lockdown, and observers and health personnel complain of a laxness that has taken hold of society. All hopes are on Uruguay's immunization campaign, which has so far provided a first dose for nearly a third of the population and 2 doses for 10%. In Argentina, people over 60 years old received the Oxford AstraZeneca vaccine against COVID-19 in Quilmes, Buenos Aires province, amid a rise in corona cases and deaths in the country. Take a look.
Por lo menos la primera ya tengo, ya estoy un poco más tranquilo por salir, porque uno tiene miedo para salir, ya no puede salir más. No puede salir a trabajar, no hacer nada.
Es que como que ahora escuchás más gente conocida que está enferma. Antes no veíamos, sabíamos por la televisión, pero ahora escuchás que un vecino, que la otra cuadra, que la más allá, que están todos mucho. Entonces tenemos que cuidarnos mucho ahora. Creo que este momento es más difícil que antes.
La verdad, sentimos orgullo por lo que estamos haciendo, porque desde el primer momento, desde que se decretó la pandemia acá en Argentina, dijimos que bueno, que tenemos que estar, que tenemos que ser los primeros. Y bueno, imagínate que desde llegar a hacer un hisopado a llegar a vacunar a tanta gente, es una cosa que no se puede explicar.
The number of COVID-19 jabs administered globally surpassed the 1 billion mark on Saturday, offering hope even as the number of virus cases worldwide hit a new daily record, mainly due to an explosion of infections in India. According to an AFP tally, at least 1,2,938,540 vaccine doses have been administered in 207 countries and territories. Nevertheless, the number of new infections topped 893,000 worldwide on Friday, a new daily record. India accounted for more than a third of these, with authorities there announcing 346,786 new cases on Saturday, a record for a single country since the start of the pandemic. Thailand, which had long avoided the worst of the virus, was also grappling with a spiraling caseload. Prime Minister Prayut Chan-o-cha said Saturday that more than 1,400 COVID-19 patients were waiting to be admitted to the hospital. The pandemic has now killed more than 3 million people worldwide since the outbreak emerged in China in December 2019. Hard-hit Brazil has seen its deadliest month yet of the virus, with nearly 68,000 reported fatalities in April, even though there is still a week to go. India reported 2,624 deaths, a daily record on Saturday, as a surge of cases has pushed the government to organize special trains to get oxygen supplies to worst-hit cities. One oxygen express carrying 30,000 liters of oxygen arrived in northern Lucknow at dawn on Saturday, where armed guards were waiting to escort trucks to hospitals. The Indian Air Force is also being used to transport oxygen tankers and other supplies around the country and to bring oxygen equipment from Singapore. Tragically, oxygen cylinders were implicated in a fire that tore through a virus-intensive care unit in the Iraqi capital, Baghdad, leaving at least 23 people dead. Up next, updates from Hawaii and Alberta. Eagle News America continues.
Start up your weekday mornings with edutainment, news and information kasama ang inyong paboritong Net25 shows. Samahan ang inyong paboritong morning barkada sa Pambansang Almusal at 5 a.m. Tatalakayin mga pangunahing balita sa pagtutulungan ng Radyo Agila at Net25. Samahan si Weng de la Fuente sa Balitalakayan, 7 a.m. Saganang Mamamayan at 8 a.m. NHK World at 9 a.m. Eagle News International at 10 a.m. At mga balitang dapat niyong malaman mula sa Agila, Pilipinas at 11 a.m. This is your morning startup every weekday mornings only here on Net25.
You're watching Eagle News America. I'm Anna Cui in Las Vegas. The COVID-19 Hate Crimes Act is a proposed legislation intended to address the rise in hate crimes and violence against Asian Americans and Pacific Islanders, or AAPI. The said bill recently passed the Senate by an overwhelming 94-1 bipartisan vote. Alfred Asenas from EBC Hawaii Pacific has more.
This legislation sends a dual message to our Asian American community. We will not tolerate violence and bigotry against you. And to those who perpetrate the violence and bigotry, we're going to pursue you to the full extent of the law.
Once the COVID-19 hate crimes bill is signed into law, the federal government will guide state and local law enforcement on how to establish online hate crime reporting procedures in multiple languages.
And an elderly man told me he's afraid to walk down the street in the house where he lives because he's been cursed at and spat upon. And a young lady told me she no longer rides the subways because the stairs were so mean and forbidding. And those two stories can be repeated thousands of times over each day in every state. So we must do something, and today we did.
The bill will also advise local governments on how to expand education programs to help law enforcement understand and interact effectively with communities from other cultures.
My 80-year-old mom came home from the grocery store visibly upset because she had, and I asked her what had happened, and she had been harassed by the grocery store clerk who kept pushing her away as she was trying to buy some grapes. And she was trying to pick out grapes, and she was told, go stand over there. So she moved over, and they said, no, go stand over there. And they just kept hassling her, and this happens all the time. And my mom finally confronted the grocery store clerk and said, listen, I'm just here to buy grapes for my granddaughter's lunch. I'm not here to fight you. Just let me buy the grapes. And this bill will allow me to go home and tell my mom we did something about it. And this bill tells the AAPI community, who are seen as the other, who are often asked, where are you from, really? And I've had that happen to me while wearing the uniform of this nation with her flag on my shoulder, been asked, where are you from, really? Yeah, your dad has been here since before the revolution, but where are you from? This tells the AAPI community, we see you, and we will stand with you, and we will protect you.
Additionally, federal agencies will issue guidance on how to diminish racially discriminatory language in addressing the COVID-19 pandemic.
I cannot tell you how important this bill is to the AAPI community, who often has felt very invisible in our country, always seen as foreign, always seen as the other. And for them to experience a kind of hatred against them through no provocation on their part, to be the victims of unprovoked, just random assaults on them as they are minding their own business in the subways, grocery stores, takeout restaurants, on the street. This bill, I would say, just as important as the substance of the bill and what we hope to do by gathering the kind of data we need, that as important as the content and substance of the bill is the message of this bill, that we in the Senate are going to stand with our AAPI community, and indeed any community that is discriminated against on the basis of race or any of the categories that you and I can think of. So as we say in Hawaii, mahalo nui loa to everyone.
According to the 2018 census, there are about 22.6 million Asian Americans and roughly 1.1 million Pacific Islanders living in the United States.
Meanwhile, the Senate has been coordinating with the House of Representatives to do a quick vote on some additional language to the most current bill before President Biden signs the finalized version, hopefully sometime in May, which also happens to be Asian American and Pacific Islander Heritage Month. Reporting from Honolulu, Hawaii, I'm Alfred Asenas, Eagle News. We live in interesting times. Back to you.
Thank you, Alfred, for that report. Now in Canada, Trudeau's government is facing pressure to increase non-essential travel bans. Bureau Chief Thomas Likeness tells us why. Thomas?
Thanks, Anna. Well, let's start our report with a vocabulary lesson. Here's a term you likely never heard until recently, unless, of course, you studied epidemiology. Variants of concern. You used that term a lot in the earlier portion of the program, Anna. We've heard that phrase flung around a lot in recent weeks, and it refers to the mutations that occur in the original COVID-19 virus. And in many cases, the variants are proving to be much more contagious, and in some cases, more deadly. And their presence is leading to calls for the Canadian government to tighten travel restrictions, maybe even close our borders entirely to non-essential travel. Now, the latest one to suggest this is the Premier of Canada's largest province, Ontario. Doug Ford has been critical of border security measures for a long time now. Ford says it's time to lock up our borders, refuse entry to anyone who doesn't have an essential reason to be here. Just last Friday, Canada suspended all non-essential traffic from India and Pakistan for 30 days, and those are two of the world hotspots for COVID-19 and its variant cousins. But Ford says that measure is too little, too late. In a statement on the weekend, the Ontario Premier says, unless we get really strict about travel, we face prolonging this third wave of the pandemic, or even worse, sparking a fourth wave. Ford says the UK variant began appearing in Canada late last year. It's the dominant strain now, and he says we should have learned from that. He says the variant that variant from the UK, incidentally, has stretched Ontario hospitals and their ICUs to the limit, and now Ford is worrying that other variants may hitch a ride on non-essential travelers and also gain a foothold in Canada. The answer says completely shut down travel unless, again, it's for essential reasons. The situation in Alberta, BC, and Quebec, similar to that in Ontario when it comes to outbreaks, variants, and pressure on hospitals. Across Canada, the third wave not only taking its toll on people, but it's also starting to cripple the infrastructure system that cares for those patients. Here's hoping Prime Minister Trudeau is listening to the Ontario Premier. In Edmonton, Canada, Thomas I. Likeness, Eagle News. We live in interesting times. Back to you, Anna.
Thank you, Thomas. We always appreciate your update. Now, you mentioned a possible fourth wave, but how is Canada coping with the third wave currently?
Okay. In the last week, Anna, the overall case counts have started to decline marginally, 2.6%, but a decline nevertheless, and hope it keeps headed that direction. But we're still seeing those hospitalization rates on the rise. They're up 20% in the last week. Intensive care units are filling up, and there's a worry they'll be hanging that no vacancy sign on the front door. Remember, hospitalization numbers are generally 2 to 3 weeks behind the new case numbers, and this, of course, because it takes a while for the infection to get bad enough to require hospital care. Lockdowns are continuing in various forms across the country. My province, well, they're dithering on what to do next. Case counts here are at near record levels. Today, we passed the 20,000 mark for active cases, and this is a level we haven't seen since last December in the second wave. The government says it will make a decision early next week on further measures. So, for the time being, we muddle through. Anna?
Yeah, so I mean, we could see the concern, right? I mean, they're trying everything they can, closing down the border with possible, possible chances of new variants coming into the country. What's happening with the Canada's vaccination program?
Okay, Anna, immunization is starting to pick up steam. We've had more doses land here. We're just about out of all of that AstraZeneca stuff that we had sitting around. The government advisors had recommended the vaccine could be used now on anyone over the age of 30. And when they lowered that age limit, a number of people flocked to the mass vaccine centers in Alberta. So that big stock of AstraZeneca that we had sitting there that was just earmarked for a very narrow demographic is now being used by a wider population. So it's almost gone. Pfizer has said it's increasing its shipments, and that's good news because we've had problems with Moderna, and that's because Moderna's had problems in its plants. It fell short of promised deliveries, although we expect to see some of that inoculant next week. And we're also worried about what's going to happen with AstraZeneca now, because most of what we get is produced in India. And I suppose there is that possibility those doses may stay there, and certainly they're needed there because of those massive outbreaks. We're also approved to use Johnson & Johnson, but we have no definite date on when that single-dose formula may start arriving here, perhaps sometime in May. Anna?
Yes, Thomas. I mean, it's good news. You mentioned the Johnson & Johnson CDC has lifted the pause on it. So hopefully, like you mentioned, hopefully you'll get some of that doses there in Canada.
Hopefully, but the problem is getting enough of it because it's a race, and the variants are they're more than a nose ahead now. If you ever follow horse racing, they're a couple of lengths ahead.
Yes. I mean, especially with the news, with the variants that we heard about the double mutants, which, later on clarified shouldn't be really not the technical term for it there in India. Well, Thomas, what are your predictions on when things will get back to some state of normal there?
Well, we'll see what the politicians, first of all, are predicting. They put on their happy faces, and they keep hoping that we can celebrate Canada Day in July with some bigger in-person gatherings. They keep telling us this is going to be the summer we can enjoy. Maybe we can lift a lot of public health measures. But then we get a dose of reality from our Chief Public Health Officer, Dr. Teresa Tam. On Friday, she gave us a couple of scenarios. She says, if we could get 75% of the adult population having its first dose and 20% having their second, hospital capacity would be able to handle the demand. It would not be exceeded if restrictions were eased. But, and again, how many people are we going to vaccinate if it's only 55% having a first dose and again 20% with the second? Then the hospitals are going to be crowded. And these are Dr. Tam's words. Capacity would be widely exceeded in the fall. And again, remember, hospital numbers lag 2 to 3 weeks behind new case numbers. My personal opinion, I think it's going to be late fall before there's much easing of restrictions. There's just too many moving parts in this third wave in Canada to act any quicker. Anna?
Well, thank you, Thomas. Always appreciate your insight, and stay safe.
You too. Always a pleasure to be here and look forward to talking to you about chairs.
Yes, absolutely. I can't wait to hear what you have to say about that, Thomas. Now, Eagle News correspondent Ruth Adornicio reports about the Southern Nevada Health District's COVID-19 update.
Thank you, Anna. We reported previously that the Health District and Clark County announced the closing of the mass vaccination site at Cashman Center on May 5 as the strategies for vaccine outreach shifted. This will allow the Health District and its partners to shift resources to smaller events like pop-up clinics and strike teams to vaccinate higher risk, harder to reach populations. So, starting Tuesday, April 27th, there will be community clinics established throughout Southern Nevada from Searchlight to North Las Vegas with varying times from 7 a.m. to 8 p.m. depending on the location and date. For more information or to book appointments, you can visit snhd.nv. Local officials continue to campaign for all eligible people to get vaccinated. Their main message is this: once 60% of the county's eligible population has received one dose of the vaccine, social distancing and capacity restrictions will be removed based on the local mitigation plan. As of April 22, 2021, there have been 829,788 COVID-19 doses initiated, 562,485 doses completed, and a total of 1,338,717 COVID-19 vaccines administered in Clark County. That puts Clark County at approximately 45% of eligible population, people 16 years and older, who have received at least one dose of the vaccine. According to officials, Southern Nevada Health District and its partners have been administering on an average of 50 to over 60,000 COVID-19 vaccines since the first week of March. If vaccination efforts continue at the same rate, they could project that 60% of the eligible population would have received at least one dose of the vaccine by the end of May. The county's goal is to fully open on June 1. As of Tuesday, the Health District also reported that 73 breakthrough infection cases among completely vaccinated residents in Clark County, which represents approximately 1 out of 10,000 people vaccinated. Breakthrough cases can occur because a person was infected before or after vaccination. It takes about 2 weeks for the body to develop protection. Officials stated during their weekly mitigation task force meeting that it is an expectation to see these cases in addition to an increase in disease transmission as the community opens up. The important thing to remember is to not let our guard down, continue to wear a mask, observe social distancing, and for those 16 years and older, get vaccinated as soon as possible. In Las Vegas, Ruth Adornicio, we live in interesting times.
Thank you, Ruth, for your update. Still to come, a report from Washington, D.C., Pennsylvania, and Washington State. This is Eagle News America. Stay with us.
Events happen around us all the time, in our community, in our country, around the world. Events that affect people, move communities, or simply inspire us. Interesting events that people need to know. In these interesting times, we continue to be a competent partner in delivering news about these events. Fast, accurate, balanced. Eagle News, because we live in interesting times.
This is Eagle News America. I'm Anna Cui in Las Vegas. Several stories from the nation's capital today. Vaccination is made easier in the district in an effort to encourage residents to receive that COVID-19 jab and get the community protected. This story and more with EBC's Eliza Gonzalez-Mangligmut. Eliza?
Thank you, Anna. Good Sunday evening to you and a safe Monday morning to our friends on the other side of the globe. Now, more good news in Washington, D.C. for people wanting to get vaccinated. Walk-up and at-home vaccinations have been set up by the district, making it easier for residents to get the much sought-after vaccination jab. Now, at least 10 walk-up vaccination sites have been established in different neighborhoods in the nation's capital for DC residents 65 and older. In addition, a walk-up vaccination site is open on appointed days at the Bald Eagle Recreation Center for residents of Ward 7 and 8 who are 18 and older. What makes the walk-up vaccination sites different is there is no appointment needed to get vaccinated in these places. Yes, that means no waiting for an email, no calling a pharmacy and being placed on hold. It means walking up. And if a person is unable to leave home to get vaccinated, DC Health is offering at-home vaccination. Now, to get vaccinated at home, people should call 1-855-363-0333 in order to make an appointment. Now, for over a week now, all DC residents 16 and older became eligible to receive the COVID-19 vaccine in the nation's capital. DC residents should pre-register for a vaccination appointment by going to vaccinate.dc.gov or calling 1-855-363-0333. Now, to further encourage all residents to get vaccinated, DC Mayor Muriel Bowser set May 1st as a day of action. Now, this day, volunteers will canvass neighborhoods and help residents pre-register and make a plan to get their free COVID-19 vaccine. Community members interested in joining the effort and helping neighbors get pre-registered should visit bit.ly/day-of-action-DC. Now, since more people are getting vaccinated, some are now thinking of traveling. For Embassy News, the Philippine Embassy here in the United States recently released an advisory to dual citizens traveling to the Philippines. The embassy wishes to remind dual citizens that the Philippine Bureau of Immigration requires the presentation of at least just one of the following documents as proof of Philippine citizenship in order to enter the Philippines. Now, these documents are a valid Philippine passport, an identification certificate, or a certificate of reacquisition or retention of Philippine citizenship. One of the documents should also be presented upon departure. Failure to present the necessary documents will result in fines and penalties on foreigners who overstay in the country. Now, to avoid any inconvenience with some airports and airlines that require additional proof of Philippine citizenship, dual citizens traveling only with their foreign passports and dual citizenship identification certificates are strongly advised to also carry an order of approval of their application for dual citizenship, their oath of allegiance, and their PSA-issued birth certificate. Now, for some weather update, it's 59 degrees Fahrenheit or 15 degrees Celsius in the nation's capital. In Washington, D.C., Eliza Gonzalez, Manglikmot, Eagle News. We live in interesting times. Back to you, Anna.
Thank you, Eliza. Great news for DC when it comes to vaccinations. I'm wondering, have you gotten vaccinated? And if so, how was the experience there in the DC area and getting an appointment?
Anna, I'm very glad to say I got my first dose last week. I wish I could tell you that it was stress-free or no stress at all, but that wouldn't be entirely true. Now, once you get the appointment, it actually is really smooth. We got it at a local pharmacy and we were in and out in about an hour. It was very well organized and not stressful at all. But getting the vaccine appointment, that's a different story. It seems like all of our friends were getting an appointment, but for some reason our family didn't have any luck. So we were looking for weeks. My husband was actually logging onto a site at the oddest hours. It's like 3 a.m., 5 a.m., 6 a.m. Just to take the chance that at these off hours an appointment would become available. But after several days, he finally got one. And yes, it was just one. It's just for himself. Because when he tried making appointments for the rest of us, all appointments were taken in a span of a few minutes. in short, my daughters and I finally got one through a friend who knew our situation, and she was scouring the pharmacies for open appointments and finally found appointments for all three of us. Anna?
Well, congratulations. How did you feel?
Just a little bit of soreness on the arm, but then other than that, we were fine. After a day, we were okay already. I'm anxious though for the second dose because I've heard stories, but I'll let you know.
Yes, please keep us updated with that. Thank you, Eliza. In other news, leaders of Pennsylvania state, cities, and communities are coming together to find a solution to reduce gun violence in Philadelphia. In Swarthmore, Bureau Chief Myla Simbulan reports. Myla?
That's right, Anna. The governor and officials met at a roundtable discussion hosted by State Senator Anthony Williams at the West Philadelphia YMCA to address ways to coordinate efforts at the state and local levels to ensure communities have resources they need to combat gun violence. Take a look.
We're here collectively, first to begin the process of organizing ourselves in a way that we've never organized before, in a way that we understand that we sit in a city that unfortunately continues the drumbeat of death by gun violence and continues the painful aftermath towards families, the destabilization in communities. In the last few weeks, in this section of the city, we have seen places that were intended to provide peace for seniors and youngsters. Recreation centers turn into places that young people and old people now fear. A simple journey where the father and his son experienced the ravages of gun violence in ways that no family should be required to have to remember. We're here because many of us who are elected are not just elected officials, but because these same communities that have been overwhelmed, we live here, we worship here, we're neighbors here, and our families are here.
Nearly 3/4 of homicides in Pennsylvania involve firearms, and more than half of all suicides in Pennsylvania involve firearms. Addressing the scourge of gun violence is a top priority for Governor Wolf. In 2019, he signed an executive order creating the Office of Gun Violence Prevention and a special counsel on gun violence within the Pennsylvania Commission on Crime and Delinquency, as well as the Division of Violence Prevention within the Pennsylvania Department of Health. As a result of recommendations of the Council, PCCD has prioritized available funding to support direct multi-year grants to organizations implementing gun violence or prevention intervention models. Most recently, in February, $3.1 million in community violence prevention or reduction grants were awarded to specifically target gun violence in Pennsylvania, with most of the awards going to support efforts in Philadelphia. This effort builds on the $3.8 million that has been released in the previous 2 years to support efforts to reduce gun violence throughout Pennsylvania. The governor has also called on the General Assembly to take up safe storage legislation to reduce the number of shootings by people who should not have access to guns, including accidental shootings by children, to tighten reporting requirements for lost or stolen guns, to swiftly pass the Extreme Risk Protection Order Act, also known as the Red Flag Law, and to pursue state-level universal background checks on all gun purchases. Last March, Governor Tom Wolf joined Attorney General Josh Shapiro, gun violence survivors, advocates, faith leaders, responsible gun owners, and elected officials on Ceasefire PA's virtual day of advocacy to end gun violence. The forum was part of a virtual advocacy day filled with meetings and discussions to start a statewide campaign promoting common sense gun safety solutions. In Swarthmore, Pennsylvania, Myla Simbulan, Eagle News. We live in interesting times. Back to you, Anna.
Thank you, Myla. Now, what's involved in that ceasefire PA?
So, Anna's ceasefire PA, it presents three legislative solutions that Governor Wolf wants to support to address what is, I think, in fact, it's a public health crisis. So, first is creating extreme risk protection orders. This is a means to temporarily remove firearms from someone who wants to hurt themselves or others. Second is reporting lost or stolen firearms within 72 hours. It helps cut community violence. And the third is closing the gaps in Pennsylvania's background check system to prevent the purchase of especially those military-style rifles from a private, non-licensed seller. Anna?
Sounds like a good plan there. Now, can you tell us, Myla, how bad is gun violence there in Philadelphia?
And Philadelphia is a great city. It has vast historical landmarks. Actually, in 2019, prior to the pandemic, a record number of 46 million people visited Philadelphia. But, you know, like many major cities here in the U.S., there's some areas or parts of Philadelphia that, you know, something that Philadelphians are not proud of. Like, you know, some places that you don't want to go, especially at night. So far this year, at least 103 people have been murdered, which is a 30% increase over the same time last year. So yeah, it's not getting better right now in Philadelphia, but actually it's getting worse. Anna?
Well, stay safe out there, Myla, and thank you for your report.
Thank you.
Up next, EBC Sports and a place in Denton, Texas that grows chairs. Plus, tonight's roundtable, a chair to remember. This is Eagle News America. Stay with us.
Hey there, Arnie Aquino here at Hatley Castle, one of the filming locations for the X-Men series. Don't forget to tune in to Digital Nest only on Net 25.
Welcome back. I'm Anna Queen in Las Vegas. This is Eagle News America. It's a good time for New York basketball fans. The winning streak of the Knicks is up to 9. In New York, Tenny Sumagi has the report. Tenny?
Anna, there's lots to love about New York basketball at the moment. The Knicks are reviving from a laughingstock team to a potential NBA title contender, winning their 9th straight game after beating the Toronto Raptors at the Garden Saturday afternoon. Sophomore RJ Barrett and rookie Obi Toppin are having fun winning, especially in front of the home crowd.
You know, it's a lot of fun winning every day. You know, especially like right now is the time, you know, you enjoy the win and then you sleep and tomorrow you move on to the next one. It's great. Winning is great. Going to try to continue to keep doing that every day. Going to try to, you know, to have fans come, try to hopefully get more fans. Just continue to have fun with it.
Yeah, it feels amazing, but I gotta give credit to the team. Like I feel like they have a lot of confidence in me, and they push me every single day to be better and to learn. So without those guys, I wouldn't do the things that I do out there. So.
Julius Randle continues to prove why he is the most valuable player on the Knicks, and his Kobe Bryant-esque work ethic is what makes him productive as an individual and a team leader.
I pride myself on my work ethic. You know, the greats, they've done it before. You know, the guy that I idolize the most and look up to, which is Kobe. His work ethic was top notch. You know, nobody was better. You know, putting the time in than him. So, you know, like I said, I pride myself on the work ethic and how I prepare myself to get ready for a season. How I prepare myself to get ready for games.
And Julius is our engine.
but we have a lot of guys stepping up, and the way that they trust the game is going to tell you, who's getting what shot. And, even if we call a play for you, doesn't mean it's your shot. It means it's your responsibility to make the right play for the team. And Julius has set the tone for that. So when the second defender comes, he'll move the ball, and then when other guys are having plays called for them, they're doing the same thing. So everyone's making the extra pass. Everyone's willing to share and sacrifice for the team, put the team first, and that's what you need to have a winning team. And there's still a lot of room for growth for us, and I think we're seeing that.
The Knicks will attempt to make it 10 in a row as they play Chris Paul and the Phoenix Suns at the Garden Monday night, New York time. In New York, Tenny Sumagi, Eagle News, we live in interesting times. Back to you, Anna.
Thank you, Tenny. So they're doing really well. I looked it up, and it looks like the last time they won a championship was 1973. So correct me if I'm wrong. But in your opinion, how far will the Knicks go this season?
Well, for the last 4 years that I've been covering sports for EBC, there's so many stories about the Knicks, from Carmelo Anthony not finishing games, and then him getting traded, and then the rise of Kristaps Porzingis, the unicorn. He revived Madison Square Garden, then he gets injured, then he doesn't want to be in the Knicks anymore, and then they fired how many coaches? So get the narrative, Anna. It's not positive for the last 4 years with the Knicks. But something about this year is, I love telling great stories, especially in sports. And a lot of attention is going to the other team out in Brooklyn. But New York's team, basketball team, I would say, majority of New Yorkers, their heart is with the Knicks. And this is a beautiful story. And I'd like to see a matchup between the Nets and the Knicks, hopefully in the playoffs. And whether or not they win the title, or whether or not they make it to the first round, it's just nice to see them on a winning high. And it's thanks to the new leadership of Leon Rose and hiring a great coach in Tom Thibodeau. And I just love the fact that Julius Randle is making it big in the NBA after 8 seasons.
Well, thank you, Tenny. We hope to hear that beautiful story of yours if the time comes. The NBA continues using its platform to speak up against social issues here in the U.S. The league and several players recently commented on the conviction of Derek Chauvin. Our EBC correspondent Michael Hudson has the report.
Thanks a lot. The NBA issued a statement earlier last week regarding the conviction of former Minneapolis police officer Derek Chauvin for the murder of George Floyd. Karl Anthony Towns of the Minnesota Timberwolves, as well as Kyrie Irving of the Brooklyn Nets, voiced a response of the verdict after their games on Tuesday night.
I was worried. I was worried for our community. I was worried for if justice was going to be served. I was worried about all the family our team has for every player, and wondering if their safety was going to be guaranteed tonight and how they would feel. And, we have also on our team, we got guys who have kids who are kids of color, and wondering if we're going to show them if the word accountability actually lives in the world we live in today. And it was great. It wasn't great, but it was a bittersweet moment that justice was served, but it was served at the cost of a life.
It's a great time to reflect and see how far we've come in the last year, with the verdict and in the case, and unfortunately losing a few lives in the last year due to police brutality and just violence out in the streets. So, we just want to continue to galvanize each other and be there for one another as human beings, and continue to support, justice being served. That's most important.
Tune into Eagle News for more stories and highlights of the NBA throughout the season. In Seattle, I'm Michael Hudson, Eagle News. We live in interesting times. Back to you.
Thank you, Michael, for that report. Now, imagine yourself on a piece of land where chairs keep sprouting up, all kinds in different shapes and sizes. Well, if you're anywhere near Denton, Texas, this picture you're playing in your head just became a reality. Eagle News correspondent Nanita Manawis has this fun story for us. Take a look.
Today we're here in Denton, Texas at the Chairy Orchard. Started by longtime friends Ann Pearson and Judy Smith in 2015, the Chairy Orchard is free to the public and is one of the attractions in the city of Denton.
My name is Judy Smith. My friend Ann and I were next door neighbors, and we've owned this lot for over 40 years. And for many years, in this back corner, in these trees, I would screw chairs into the trees, and we always called it the cherry tree. And then about 5 years ago, Ann had the idea of expanding onto the ground and make a cherry orchard. And because we go to garage sales every Saturday, we thought we would find chairs and just bring them out here. So we took a hose, a garden hose, and we made an outline. And that's where we started filling it up with chairs. And it took us maybe 3 or 4 months, and we came up with 100 chairs. And it was so easy that we said, all right, we're just going to keep going. So we moved the garden hose out further where it is now, and we just kept buying more chairs. Plus people donated chairs, and we find them at curbs, and we go to thrift shops. So we have lots of ways of getting the chairs. And now it's just growing every few months. We think of something new. Like we recently did the libraries, which have children's books that are free. You don't even have to bring other ones back. We find more at garage sales. And we recently started having a scavenger hunt, which has been very successful. It's been fun watching people walk around with their pink slip and checking things off. We have lots of other features that we are always changing. And the arch was made by our friend, Mark Holderbaum, who is an artist. And he welded 24 chairs together to make a kind of a grand entrance for us. So that's the beginning of the Chairy Orchard. And then we also have what we call the Red Fridge. That's a souvenir booth, and we sell postcards, bottled water, and pens that have Chairy Orchard on. And that raises money for us to buy more chairs, and if we have extra money, we donate it to our Daily Bread, which feeds homeless men and women. I have always loved chairs because to me, a chair is like a little person. It has a back, it has legs, it has arms, and you can treat it like a person. We think that because every one of these chairs was chosen by somebody. They were bought in a store, they went into a home, they were in their bedroom or their dining room or their kitchen. You know, there's an aura here that these chairs belong to somebody, and we've given them a new life.
Reporting from Denton, Texas, this is Nanita Manawis, Eagle News. We live in interesting times.
Thank you, Nanita. I really like that story. I like that I believe her name was Joyce. You know, what she said about a chair is just like a person. It has a back and legs. Beautiful story. Now brings us to our roundtable discussion. Even every chair has dozens of stories to tell, as we heard from that feature. Tonight we get to listen to some of these stories from our Eagle News team here, who's on with us tonight. Let's ask what special story about the chair that you're going to share with us with. So let's start with Thomas.
Okay, Anna, the chair, I don't know that they're going to put it up there on the screen. It's an old-time rocking chair, and normally you think of, you know, a grandfatherly type person sitting in that, enjoying retirement on the front porch. That particular chair belonged to my father, and he bought it when he was probably in his mid-50s. He had a bad back, and on the advice of his chiropractor, he got out of the recliner and into one of these, And for years, he would spend the evening reading or watching TV in that chair. And for me, it kind of brings back memories. It's in our home now. It makes me wish we had more time together because growing up, times were such, my father worked a lot. And by the time he slowed down, I had left home and I worked a lot, living in first the U.S. and then Canada. But, you know, having that chair in a spare room, it brings back some memories, and it is comfortable. It is really comfortable, and the worst thing for your back is that recliner, the Barco Lounger. Anna?
Thank you, Tom. I was going to ask you if you know if it is comfortable, because you see all these expensive recliners that comes with lots of promises, right? But look at that.
Yeah, you know, the problem with them is I sit in them and I'm asleep in 15 minutes. And a couple of hours, I wake up and I can hardly walk.
So nothing like a good old rocking chair, wooden rocking chair.
Rocking chair, yeah.
Yes. Thank you for sharing that, Thomas. Now, what about, let's go to Tenny. Tenny, tell us about a chair, of your favorite chair.
Oh, let's see. I don't know. I sent a picture, and it was, I don't know if they'll show it, but I'm sitting on a chair that has tennis balls because Penny loves tennis. I don't know if they'll see it, but I sat on this was back in when the last time the U.S. Open was pre-COVID, or I should say post-COVID. It was just in one of those photo booths where where you take your picture and you just sit on this nice chair that is beautiful, with a bunch of tennis balls, and just a nice story. Just because my name is Penny, that doesn't mean I like tennis, but I actually tennis was actually the first sport I learned how to play because my dad, my late father, was a big tennis fan, and I always wanted to be a ball girl at the U.S. Open, but I've never accomplished that. But I can sport tennis now.
Thank you for sharing. That is a huge chair. I couldn't tell from here whether it was. At first, I thought it was like made out of Legos, but it's even more interesting that it's made out of tennis balls. Thank you for sharing. Now let's go to Eliza. Eliza, tell us about your favorite chair.
Okay, this it's actually a dining table with 6 chairs. This dining table, it's 64 years old. It's older than I am and older than some of my siblings. Now, Anna, they used to be varnished black, and then my dad painted them white, and now they're varnished golden oak, I think. Now, if chairs could hear, if they could talk, these chairs have heard all conversations made at our dining table. This is in the Philippines, because at the dining table is where we talked to each other. It's always over food. And my sister recalls every payday, she would watch our father count his money and put them in envelopes to pay bills the next day. And I remember also these chairs being placed upside down on the table every Saturday morning, because it means my brothers had to mop the floor. That's their chore every weekend. And this is also where I sat when I was still in school. This is where I studied and worked on projects. So I hope this table stays with the family for as long as it still stands.
That is beautiful. Just like from that story Danita showed us, these pieces of furniture become parts of our family, right?
They do.
Thank you, Eliza. Now, what about Myla? Myla, let's hear about your favorite chair.
So yes, my favorite chair, or actually our family's favorite chair, is a beanbag. It's on our basement. It's huge, it's 7 feet, and it's heavy. It's about 25 pounds. And every time we use that, because in our basement we have this projection to project whatever we want to watch. And every time we have a movie night, whoever is the first person who goes down the basement will be able to use this. And sometimes you can sleep on it as well. It's really, really comfortable. And everyone in my family loves it. Anna?
I bet everybody rushes down there, right, to get the first bed. Get to sit on that chair. Thank you, Myla. Well, my favorite chair is
your story. Your story, Anna. Come on.
Quickly for me, it's the chair that I'm sitting on right now. It's actually because it's, you know, it's a chair that I've been using when we first went onto lockdown, when we started reporting from home. So that has a special meaning to me now. And good story is that this chair was actually just given to us by a friend. So this is my favorite chair. Well, thank you to our team tonight for joining us in our roundtable. It's always a pleasure to learn a little bit more about each other. And before we go, we want to greet Radio Aguila, a 53rd anniversary. Congratulations. And now it's time to thank our frontliners, the first responders and essential workers, with a much-deserved round of applause. Let's join hands, team, in giving them a round of applause. We appreciate you for everything that you do. That is today's Eagle News America. Thank you for joining us. I'm Anna Cui, and we live in interesting times.